Okay, Anon says yes. Okay, Sarah, Natalia, can you hear me? Okay. Natalia, I looked at that question that you sent. Did you see the email I just sent you back that they discontinued that question? Yeah, they're not going to ask you that on the test. They discontinued that one because of the answer choices were too ambiguous, so they discontinued that question. All right. So where are we starting today? So what quiz are we starting with today first? Renal? All right. All right. How easy was renal? Was renal super easy? Okay, it was a little hard. Okay. All right, no problem. So when we go through this, I'm sure there'll be some questions that you need answered. So I'll go through those with you, help you with those. As far as the ASDA papers, I always say start with the most current and go back at least uh, probably no more than 4 or 5 years. But I always say start with the most current, okay? All right, so let's go ahead and pull one of these up. And I'm going to share my screen with you. All right, can everyone see my screen okay? Okay. Yeah, no problem. You have a question? You talking about for renal, Sarah? Okay. Yeah, no problem. As soon as we get through with the quiz, we'll go through that question, okay? All right. Okay, number one. Okay, Anon says one, Natalia one. All right. All right, let's go. Anon put that one up first. Let's do this. Print screen. All right. Okay, Anon, are you there?
Yes.
All right. All right. So what is this question asking?
I answered this question was I thought that it was 25, I think, because it's asking for the GFR
Okay.
and we use inulin. Is that right?
Okay. So yeah. So there. Oh,
So
hold on one second. Let me get my paper. All right. So yes. So they are asking. So data obtained. Okay. So what is the GFR? You are correct. So we know that
yeah,
GFR is equal to the urine concentration of inulin, right?
yes.
So I'm gonna just put the number there. That's gonna be 500, right?
Mm-hmm.
Times the urine flow, which is 2, correct?
I didn't do that. I only put it 500 over 20
No, no.
because
So
uh,
the formula for GFR is equal
yeah, it's concentration times flow over plasma concentration.
to okay, urine flow over plasma concentration. Correct. That's the formula, right?
Yeah, but I didn't put the urine flow because it's not inulin. It's
No, no, urine flow.
milligram.
No, urine flow. Oh, no, no. But when they say urine flow, it doesn't matter. It's just the urine flow. It doesn't have to be for
Uh huh.
inulin.
Okay.
You understand that?
Yes, yes. So urine flow doesn't have to be inulin.
No,
Can
no,
be.
no. Urine
Yeah.
flow just means how the urine is being excreted.
Okay.
Okay. So do you understand that
All
answer
right.
now?
Yes. Okay.
Okay. All right. Does everybody understand that? Okay. Any questions before I go to the next one? Nope. Okay. All right. Let's go to the next one. Okay. Let's go back. Sarah says, do you have to convert? Well, if you look at this, you already have 500 milligrams per deciliter, right? And then the urine flow is 2 mLs per minute, right? And then if you look at the plasma inulin, it's already milliliters per deciliter. So that's already going to take care of that. So there's nothing to convert there. Okay? All right, got it? All right. Okay, let's take a look at the next question. I think Sarah said number 2. Look at number 2. All right, Sarah, how did you approach this one, Sarah? Uh-oh, microphone sounds funny.
Okay, can you hear me now?
It's doing that sound again. Yes.
Okay. Okay, so I use the clearance formula.
Okay.
So that
So let me just put this and tell me what goes at the top and the bottom.
so I have urine so I have urine X times urine flow over P, so plasma X.
Okay, so what goes at the top?
So
The numbers?
okay, so I had 30
Good.
times 30 times the urine flow, so times 2 over
Okay. Over.
150.
Yeah, that's right.
Oh, okay.
So
I think
did
I
you get
just
the answer
only
wrong?
I got 0.6. Wait, 5?
Okay, so you know it's 60, right?
Mm-hmm.
30 times 2 is 60 over 150.
Oh, I see what I did. Okay. It was just
Okay.
a simple mistake.
Oh,
Or
okay.
a stupid
All right.
mistake.
All right, got it.
Okay.
All right. All right, cool. All righty. Everybody follow that? Everybody good? All right, that's number 2. All right. How about number 3? Okay. Number 4. Number 5. All right, Natalia says number 5. Okay, let me pull that up. All right, Natalia. All right. Okay, you there, Natalia?
Yes, I'm here. I just
All
don't
right.
understand why sodium serum increase.
Good question. All right, so let me explain this one to you, okay?
Okay.
So, all right, so so basically what they're talking about is sweating, right?
Yes.
And whenever you sweat, you lose sodium chloride, right? Sodium.
Mm-hmm. Right.
So that means it's going to leave the body, right?
Yes.
So so let me draw the compartments. You have intracellular, right? And you have extracellular. You with me?
Yes.
So if I sweat a lot, right? If I sweat a lot, then
Yeah.
we know what's going to happen to the extracellular osmolarity. What's going to happen here?
It's gonna decrease.
Think about it. Because what am I losing? I'm losing, when you sweat, you're also losing what?
Water.
Yes. So if you lose a lot of water, what's going to happen to what's left in the extracellular? It's
Okay.
going to become more
We're losing,
concentrated.
we're losing sodium too when we're sweating.
Yes, but you don't lose as much. You lose. Think about when you're sweating. Are you losing more sodium or water?
Water.
Yes. So the sodium, so your concentration, the osmolarity is going to go up, right? Because you think about it like this. Osmolarity basically means the uh, attraction of water, right?
Mm-hmm.
That's what osmolarity means. So if you're sweating, don't you think now the extracellular is going to want to attract more water?
Mm-hmm.
But the reason why it wants to attract more water is because it's more concentrated now.
Okay.
But think about this though. Look at if you answered two correctly. Let's look at two, right? If you said number two is correct and extracellular volume decreases, then that means you're saying that you're losing water.
Mm-hmm.
And if you're losing water, that means you have to become more concentrated in the extracellular, right?
Yes, right. I thought I was just losing like equal amount water and sodium. Yeah, now I get it.
Right, right. And then, of course, the sodium is going to increase in the extracellular.
Mm-hmm.
Okay, got it?
Yeah, yeah. Thank you.
All right, no problem. All right. Okay, everybody's good with that. That's number 5. All right, number 6. Number 7. Number 8. Number 9. 10. Number 11. Number 12. 13. Number 14. All right, gotcha, Sarah.
So I understand I was able to eliminate and get the answer, but I don't exactly understand the ANH hormone, what it does. ANP? It's
Okay.
ANP? Or
Oh, okay. Yeah, atrial natriuretic
yeah,
peptide.
that's what it's talking about, right?
That's right. A and P is atrial natriuretic
Okay.
peptide. And what that does is it basically helps you to excrete sodium from the body.
Okay.
So if you excrete sodium from the body, it's going to decrease your blood pressure, right?
Okay.
So let's look at this question, and it's saying which of these increases the amount of urine produced,
Mm-hmm.
right? So urine means you're going to have more fluid flowing,
Right.
right? So that means then if I have imagine you have your collecting ducts,
Mm-hmm.
right? And all of a sudden I have this ANP, atrial natriuretic hormone,
Mm-hmm.
right? It's going to put a lot of sodium in the collecting ducts,
Okay.
right? And what is going to follow that sodium?
Um, Water will follow it.
Right. That's right.
Mm-hmm.
So then that means you're going to increase the urine output.
Okay. So it causes sodium to be secreted. Okay, and
That's
then
right. Uh-huh.
excreted. And I always remember it's on exams, it was always with the heart. Some question to do with the heart.
Yes. That's right. So ANP is a hormone of the heart.
Okay, just because it decreases the blood pressure.
That's right. That's one of its effects. It decreases blood pressure. That is correct. Okay. All right. Good question. Okay. All right. Next one is 14. Right, number 15. Number 16. Number 17. All right, and Sarah, you had a question about the renal
Yes,
section?
so in the notes, it was on one of the question PowerPoints. I can just read it to you if you want.
Okay. All right.
Okay, so the question
Yeah,
was,
yeah, just read
the
it to me.
plasma osmolarity decreases after infusion of.
Okay, 1 second. The plasma
Mhm.
osmolarity decreases after
Or
the
after infusion
infusion
of.
of. Now, all right, don't say anything else. Let's look at this first before
Okay.
before you give me any answer choices, okay? So as soon as you tell me that the plasma osmolarity decreases, right? So let's draw a picture of that. So here's our blood, right? So that means then, if I'm looking at this is tissue out here, okay? So that means then, if the plasma osmolarity is decreasing, right? Where's the concentration higher, in the
In
plasma or the
the
tissue?
tissue.
Okay, right. So you're going to have more solute in the tissue, correct? All right, because
Yeah.
the osmolarity decreased. All right. So now the question says the plasma osmolarity decreases after what? So what would make this osmolarity
Okay, the
go down?
plasma. Yes.
More water, right? Okay. So
So,
now give me the answer choices.
okay, so I have 3 of the answer choices. This is what I eliminated it down to. Let me
Wait,
see.
what are all the answer choices?
So aldosterone,
Okay,
and then
aldosterone.
ADH,
Okay.
and angiotensin 2.
Angio.
Okay, 1 sec. I just have to
Okay.
pull up the questions.
Now, even with just these 3, I can eliminate
Yeah,
2 choices right away because they're in the
I
same
saw
pathway.
that, so I was able to get the right answer, but I guess I'm confused.
So which 2
So
which 2 am I
angiotensin
talking
2
about?
goes to aldosterone eventually.
Okay. All right. All right. So those are out. Okay. Now, you remember we just looked at the collecting ducts, right? And then in the collecting ducts, you have
Right.
these things called aquaporin channels, right? And what is the function of
When
the
they
aquaporin
open, they
channels? To
bring
do
in
what?
water.
What water where?
Out of the, oh, they reabsorb water.
Right. So into the blood, right? Now, if you reabsorb water into the blood, what happens to the
Oh, it
osmolarity of the
increases.
blood?
Osmolarity
Whoa, wait a minute.
decreases.
Wait, think about it.
Yeah, so it
Osmolarity
decreases
means
because it's
concentration.
less concentrated.
That's right. That's right. You understand that?
Oh, okay. So that would be
Is that the
increasing the
question you had?
osmolarity. Oh wait,
What
no,
would?
it would be decreasing.
No, ADH. If you add ADH, it's going to bring water into the blood, which is going to decrease the plasma osmolarity.
Okay. So yes, I understand that. But what about,
Do you understand?
doesn't aldosterone also increase blood pressure and
No, but it does what? aldosterone increases what though?
Right.
Sodium. Sodium makes it
Okay.
more concentrated. Sodium is a solid.
But it also brings in water with the sodium, right?
No, 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 no. No, no. But that's not what aldosterone does.
Okay.
Aldosterone increases sodium. It regulates sodium
Okay.
reabsorption, not water. Water will just follow, but that's not what
Okay.
aldosterone does. So so if you had aldosterone and just say you had a problem with water, say you were dehydrated, right? Aldosterone couldn't mysteriously bring in water because its
Okay.
purpose
So I
is to
shouldn't think
regulate
about
sodium.
water when I think of aldosterone.
No, well, you can think of it in terms of blood pressure. Like if you say, hey, what effect does aldosterone have on blood pressure? Well, it's going to increase it because when you have more solid, like sodium,
Okay.
it will attract more water. That is true. But the thing is that sodium itself is a solute,
Oh, I
which
see.
basically is going to
Okay.
increase your
Because
osmolarity.
ADH is just bringing in water. Okay.
That's right. ADH
Okay.
only
I
regulates
think I
those
was just
aquaporin
getting
channels.
it confused because, yeah, I was just getting it confused because it also brings in water, but it's also bringing in, it's mostly the purpose is the increasing the concentration. Okay.
That's right. That's right.
Okay.
That's right. That's exactly what it does. Okay, no problem. Okay, Anon, yes, Anon, we're going to look at the pre-quiz right now. Let's go there. All right, so let's go through the pre-quiz, okay? Number one. Okay, number two. Number three. Number four. Okay, perfect. All right, Anon, let's take a look at number four.
Sorry. Yeah, sorry, I pressed not this question. Sorry.
Okay, go ahead and turn your microphone
Yeah.
on.
Sorry.
Okay, all right, not this one. All right. All right, let's go. Okay, that was number five. Number six. Number seven. Number eight. Nine. Okay, number 10. Okay, so no questions. Okay. All right. Oh, number 10.
I just got
Not number
confused a
10.
little
Which
bit
number?
because I write it down number 10, but it's not this number 10.
Tally says no.
Maybe it's
Okay.
different. Sorry.
All right. So I guess no question.
Yeah, I have a question on the one of the PowerPoint
Okay.
questions.
So no questions on this one?
If patient
Anand, you have a
inhales
question?
large amount of carbon dioxide, the most likely effect on the body would be. I thought that it's gonna be, yeah.
Okay. So let me
Yeah,
write
has
that.
except a large amount of
So
CO2.
you said the patient
And
has increased CO2?
and what is the most likely effect on the body? I thought that it's gonna be respiratory
Okay. All right.
acidosis, but the answer was respiratory alkalosis.
Well, okay.
Yeah.
Wait a minute. I need to see that question. Hold on, give me 1 second, okay?
Okay. 1 second.
All right. So you're gonna have to tell me which document it is.
Yes. There are two documents,
Was
but
under
I
the renal
can't read the
section?
name of them.
Okay.
But it has 10
Right.
slides.
And is which document?
Slide number 8. No, not this one. No.
Yeah. Okay. Let me open this one up and see. Not that one. Okay.
Yes. Slide number 8.
This one.
Yes.
All right. Let's go down to slide number 8. Okay. Perfect. This one right here. All right. All right. So this question says, let's move this down. It says if a patient is excited, right?
Yeah.
Before two
Not inhale.
contractions,
Yeah.
Oh no, you missed something. Look at what it
Yes.
said. It exhales.
Okay.
See that word?
Yes. Thank you.
That means you release
Yeah,
carbon
also, I
dioxide.
have a question about the vomiting and diarrhea. When
Okay.
you
Does that
vomit,
answer your
your
question?
body will be metabolic acidosis,
Okay.
and when you have diarrhea, you will have metabolic acidosis. Is that right?
Okay.
Metabolic alkalosis. Yeah. And
If you're
and diarrhea
vomiting,
is
you
the
will
opposite.
be
It's,
alkalosis.
yeah. Okay. Thank you.
Right, because you're removing the acid. That's correct. You are right. You are correct. Good job. And yes, Sarah, that is true about A and T. All right. All right. Let's see where are we at now. I think we're on which quiz are we on now? Are we on respiratory? Oh, endocrine. All right. Let's go to the endocrine quiz. All right. Now, after we've gone through the renal, did that seem a little bit better in terms of understanding? All right. All right. Let's take a look at endocrine. All right. Okay. Number 1. 2. Number 3. All right, Sarah says 3. Pull that up. All right, Sarah.
Okay, so I answered D on this question.
All right, Sarah. What's your question?
Okay. Yes.
Okay. So
I put
the question is about
D.
insulin, right? And it says, okay, so basically it's saying, what does insulin do, right? And what did you pick?
Mm-hmm.
Okay, let's take a look at D first. All right. Increased glycogen synthase. All right, you with me there? Now, glycogen synthase is the rate limiting enzyme for what?
Yes.
Okay, so you remember in I think metabolism, I went through all of the rate limiting enzymes.
Yeah, that was in metabolism.
And you remember I talked about glycogen glycogen phosphorylase versus glycogen synthase.
So I guess I thought because glycogen is a bunch of glucose.
So one of them breaks down glycogen, the other one makes glycogen.
Oh, synthase is making glycogen.
Well, before you answer that, what is glycogen synthase? What is glycogen phosphorylase? Okay, good. And phosphorylase does what?
Breaking it down.
All right. Now, which of these would increase your blood glucose?
Mm-hmm.
Very good. So I'm gonna put that under there, okay? So if I decrease glycogen phosphorylase, right? What is going to happen to my blood glucose?
No. Okay.
So do I need insulin if I have a low blood glucose?
Well, I was thinking insulin would promote making more glycogen because you want to store the glucose.
Right? So do you understand that?
Insulin saves
you're missing the question.
the sugar.
What is the purpose of insulin? What's the purpose? Why do you even have insulin?
I don't know. Okay, I think.
You're hurting me, Sarah. You're hurting me. No.
Oh my gosh. Okay, let me go.
I gave this story about DJ insulin.
I remember it.
And glucose. You don't remember that story? Do you remember that story?
Right.
And I talked about what DJ insulin does, and I said at the end, I said the whole purpose of insulin is to decrease blood glucose, right?
Right.
So, for instance, somebody who's diabetic, right? If they're diabetic, they take insulin.
No.
Because their blood glucose is too high, right? If your blood glucose is not high, should I give you insulin? So this question is saying insulin promotes, meaning insulin is going to do. Why do you need insulin, right? You need it if the glucose in the blood is too high. But if you have a decrease,
I guess
in glycogen phosphorylase,
when it says
that means you're
insulin promotes,
decreasing the
to me
blood
that
glucose.
means it's going to encourage
you're decreasing the breakdown of
glycogen to form and remove the glucose from the blood. Or maybe I'm just very... Okay. Okay.
Oh, wait. Okay. I think you're on the right track there. Now, you're not wrong.
Yeah.
You're
Yes.
actually not wrong. You said, make sure you're saying this right. So you're saying, okay, insulin, I want you to help me remove this glucose, correct?
I thought so.
Okay.
Yeah.
Now,
Oh, okay.
look at D.
Oh,
D
okay.
says it
Okay.
promotes the increase of glycogen synthase. Is that true?
Okay, I see
Yes.
now.
That is
I
true.
think I was
I'm
just
with
stuck
you.
on the first part of it
That's totally true. That's
because
totally true.
then D doesn't even it doesn't
And
even
the
make sense
decrease
if you're
of glycogen
doing both of those.
phosphorylase.
Yes, I understand.
Okay. Okay. So you understand that? Okay, gotcha. All right. All right, good question. That was number 3. All right, number 4. And you know what, Sarah? This is interesting. If you looked at number four was like a little hint to number 3 because glucagon does the opposite, where it actually increases blood glucose, right? So that's kind of like the opposite of insulin. Okay. Okay. Number 5, 6, 7, 8, 9, 10,
So I guess I
11,
just saw the
number
melanocyte
10.
option,
Okay. All right, cool. All righty.
and
Okay. So
it's
number
asking
10,
what
go
is
ahead,
not
Sarah.
released from the anterior pituitary.
Uh-huh.
Mm-hmm.
And what's the question asked?
Gonadotropin releasing hormone.
Okay, so let me underline that.
Releasing.
Not
So
released by the
that's
anterior
from
pituitary.
the
Okay. Now, what is
hypothalamus.
C?
Yes.
Gonadotropin what? What kind of hormone?
Yeah.
And what do releasing hormone? So that you know for sure, right?
Mm-hmm.
D, you really don't know because we didn't talk about it, correct? But you knew C was wrong because C
Right.
had to
Okay.
come from the hypothalamus because it had the word releasing in it. So this should not have even been a debate. This is one of those ones that even if you don't know what D is talking about, you know C is wrong. Okay. Now, and just now, melanocyte stimulating MSH does not fit into the flat pig,
So
but
just
it is a stimulating hormone that is
I don't want to tell
sometimes
you.
released from the anterior pituitary. However, that doesn't even
Okay.
matter
So just read
because
the
you
question
knew what the
better.
right answer was. Now, what did you pick? Did you pick D? Don't tell me. Don't tell me. I don't want to know. I don't want to know. All right. Okay. There you go. Just yeah. Go. You got it. All right. That's number 10. Okay. All right. Number 11. Number 12. 13.
All right. So I guess I don't know if this
Okay,
is
good. Yeah,
just
let's
a
talk. Yeah,
definition
that's
thing.
14. This is
I
a
didn't know
little
between
endocrine
insulin dependent and
pathology.
non-insulin dependent.
All right. What's your question on this
Okay.
one? Okay, great. Now,
Mm-hmm.
this one, if you missed it right now, I can understand because you haven't gone through the pathology yet. Now, so a couple clues in this question. One, the
Right.
fact that
Yeah.
he's 54 years old, right? The other thing
Okay.
is it's going to be diabetes based on the polyuria,
Okay.
polydipsia, right? It's going to be diabetes. Now, the difference is insulin dependent is typically considered type 1. Non-insulin
Okay.
is considered type 2, right? Type 2 is the one that typically presents at an older, like, when people are older,
Oh
it's
yeah.
related
I
to like the
remember that.
environment, they're not eating right, they're obese, things like that, okay? Type 1 used to be called juvenile diabetes because this is the one that you could actually be born with.
Right. Okay.
Right. So
And
so
then
that's so based on the fact that he's
okay.
54 and they said
Yeah,
this has
that's
only
not a
happened for the
problem with
past
the
2 years,
pancreas and insulin, right? So
that's where you think, okay, this must be type 2, non-insulin dependent. Okay? But
mm-hmm.
diabetes insipidus, yeah, insipidus could be a problem with either the pituitary, like the posterior pituitary, or a problem in the kidneys at the collecting ducts. So anytime somebody has diabetes
Okay.
insipidus, that means either they're not producing ADH,
Mm-hmm.
or the collecting ducts is not recognizing ADH. That's the difference. That's what diabetes insipidus is. And there are two types and we call it DI, diabetes insipidus. There's what we call the
Okay.
neurogenic and then the nephrogenic. Okay. And so, of course, if it's neurogenic, that means
Okay.
ADH is not produced. Okay.
So this
If it's
question
nephrogenic,
isn't so they
ADH
both have polyuria,
is
right?
not
Insipidus
recognized.
and
It means it's
mellitus.
produced, but the kidneys are not recognizing. Okay.
Okay. And so the answer, how would we eliminate insipidus from the answer choices here? Because he's older?
Yeah. Yeah. All three of these, all three have
Okay.
polyuria.
Okay. So diabetes insipidus are usually born with it?
Um, yeah, the fact that he's older and it only started 2 years ago, that
Right.
typically lets you know it's type 2 diabetes.
Okay.
No, but they would have to give you
Okay.
something else because you're thinking there's a problem in the brain, right?
Thank you.
They could have a tumor. That's typically related to somebody who had a tumor in the brain. They'd have to give you something else to let you know something went on with the brain or the kidneys. Okay. All right, no problem. All right, that's number 14. Okay. All right, number 15. Number 16.
Yeah, I answered this one right, but I just want to ask about the parathyroid hormone.
17.
It decreases
Okay. 15. Let's
it
go
decreases the
back.
calcium
All
in the
right, go ahead,
bone
Anon.
and increases in the blood. Is that right? And how about the calcitonin?
Okay,
Calcitonin. So the opposite?
that is
Okay.
correct.
Okay. And it doesn't, it
It does.
increases the bone
Calcitonin
density?
is going to increase the calcium in the bone
Yeah.
and decrease the calcium in the blood.
Okay. Okay.
Yes. Mhm. Okay. That's right. Calcitonin will increase bone density. All right. Okay. Number 16. Okay. 17. All right. 18. 19.
Okay, so this question stems from the question you asked about when you
Any question? All right. So everybody's good with
let me
this?
see, the
Yes. Go
17
ahead, Sarah. What's
alpha
your question about testosterone?
hydroxylase, when you block that. So I know testosterone is produced from the luteinizing hormone.
Uh-huh.
So by the
Yes.
Leydig cells, but okay, but is it just stored in the zona reticularis, or is it also produced there?
Okay. Good. Correct.
Right.
Yeah, so the zona reticularis is where you find all of your androgens, right?
Mm-hmm.
Now, it's not just testosterone, right? It's any of the androgens, and the major purpose, right, is that all of the
Okay.
precursors, right? So think of it like this: the zona reticularis is going to give you all the precursor androgens. So it's not going to give you testosterone, but it's going to give you the precursor to testosterone. It's not going to give you estrogen, but it's going to give you the precursor to estrogen.
Okay.
Now, I can tell you the names of them, like dehydroepiandrosterone. There's some names that you don't need to know, but basically it is they give you the precursors to the steroids. Now, once you have those precursors, right, and then they're converted in the adrenal cortex, right?
Right.
Now, think about it like this. If you did not have that 17, like say beta hydroxylase, then you're not going to convert because you need that for the conversion, right? So once that's done,
so it's
then
not
basically they're going to be released into the bloodstream, and then they're going to go, like for instance, testosterone is going to go to the testes, right? Estrogen is going to go to the ovaries. So that's basically how you have to look at it.
Okay.
Right. Well, just think of it like this: that testosterone,
So
the
does that
precursors
mean, but
are
that
there.
means that's
You're right.
completely separate
The
from
reaction,
the
it needs to
luteinizing
happen.
hormone?
You need the
where it just
enzymes for that to
produces-
happen. Once that happens, it'll travel through the bloodstream to the testes.
Or the Yes.
Did you say luteinizing? Now, if you say if you say luteinizing hormone, oh, you're talking about luteinizing hormone in terms of the Leydig cells.
Or no.
Okay, I got you. I see what you're asking now. So the Leydig, So whenever you talk about the Leydig cells, right? Are you talking about the adrenal cortex? No. The answer is no. The Leydig, you're talking about the testicles.
Okay.
Yeah. So whenever you say Leydig cells, you're basically talking about the Leydig cells are going to be found in what we call the seminiferous tubules of your testicles. they produce testosterone. Now, they only produce testosterone if LH is present. Okay? You got it? All right. Okay, good. All right. Anon says alpha hydroxylase increases aldosterone. Are you talking about the 17 alpha hydroxylase?
Oh, yeah, sorry. Even the testosterone and cortisol. So it increases all of them?
That is correct. The 17 alpha hydroxylase is going to increase all of your steroid hormones.
Okay. Thank you.
And I think your microphone is on. Right. Yeah, all of your steroid hormones are increased due to 17 alpha hydroxylase. Okay. All right. Good. All right. So I think there was a pre-quiz for endocrine. Let's go see. I think there was. All right. Number 1. All right. Number 2. 3. Number 4. Number 5. Number 6. 7. 8. Number 9. Number 10.
Yeah, I just want to ask, the anterior pituitary gland are produced
All right, so no questions on
in the
this
hypothalamus.
one, right?
Because
Okay, so that was renal.
In the first 8,
yes, go ahead.
said that it's secreted within the hypothalamus. And 417. Or
no.
Maybe I don't understand the sentence. Yeah.
What page are you
above
looking
the
at?
schedule, point number 3.
Okay, give me 1 second. Let me get there.
No.
Okay,
Below.
417.
These factors
417.
are
Okay, I'm looking at 417.